Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. COVID-19 cases surge further as Nigeria records a new high of over 4,000 positive infections. Governor Dakwa Abiodun calls for moderation as festive activities heighten across the country, asks residents to get a booster dose. And United Arab Emirates takes new steps in curbing sudden spike in COVID cases as Expo suspends some events as a precaution against the virus. Thank you for joining us. Nigeria last night reported 4,035 COVID-19 cases, the highest ever daily infection tally since the disease was first detected in the country. The Nigeria Center for Disease Control, NCDC, disclosed this in its daily update about the pandemic. A breakdown of the new infections shows that they were confirmed in 15 states in the country, with Lagos leading the chart. Here's more on the pandemic update.
5 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 15 states. That's an increase from the figures reported earlier. Lagos accounted for the highest number of cases with 3,393 positive samples, Rivers 260, Edo 62, Akwa Ibom 42, Kaduna 39, Ekiti and Oyo had 38 cases, while Delta and Kano registered 31 cases each. Ogun logged 30 cases, Abia 26, Bauchi 15, Ondo 14, Enugu 9, and Kwara registered 7 cases. The total confirmed cases in Nigeria now stands at 231,413. 92 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 211,853. There were 2 additional deaths recorded in the last 24 hours, raising the fatality toll to 2,991. Currently, there are over 16,000 active cases in Nigeria, while over 3.7 million samples have been tested so far. More than 9 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 4.2 million persons have been fully vaccinated. The total global confirmed cases have surpassed 277 million, while deaths are beyond 5.3 million.
As residents of Ogun State prepare for the Yuletide celebrations, the state governor, Dakwa Abiodun, has called for moderation and responsiveness in the face of the ravaging COVID-19 pandemic. He made the call in Abeokuta, the state capital, during the swearing-in ceremony of 5 new judges for the State Court of Appeal and Magistrate Courts, while asking residents to make themselves readily available for the ongoing booster shot of the vaccines. He, however, called for strict adherence to the safety measures to reduce the spread.
I want to please enjoin all of us here today that are yet to be vaccinated to please go ahead and do so. I want to assume that everyone here seated has been doubly vaccinated. We have started giving out the booster dose for those that have been vaccinated at least 6 months ago. So if you have, please present yourself for the booster dose vaccination. COVID-19 is real. We're now experiencing what they call the 4th wave. Holiday seasons like this are characterized by even more prevalence of the disease. Let us be responsible in celebration.
Staying in the southwest, the Oyo State government says it will not relent in efforts towards COVID-19 care and control in the state as the governor, Seyi Makinde, received the COVID-19 booster shot to further protect against the virus. The governor, while flagging off the COVID-19 mass vaccination campaign in the state, made this commitment, calling on the people to get vaccinated. He maintains that the flag off is another logical step taken to curtail the spread of the pandemic.
The mass COVID-19 vaccination campaign is still ongoing across states. In Oyo State, traders at a popular market in Ibadan, the state capital, are being addressed on the need to get vaccinated to ensure safety against the disease. Governor Seyi Makinde has taken the lead in Oyo State as he receives his COVID-19 booster dose. He says this step is based on the scientific position that vaccines remain one of the most effective tools in protecting people against the virus.
I call on the good people of Oyo State to take advantage of this free service to get vaccinated against COVID-19 and give themselves and their loved ones an added layer of protection against the coronavirus.
The state government says the vaccination campaign will be done across the 33 local government areas in the state.
We have been able to vaccinate over 722,000 people across the state, with just over 200,000 that are fully vaccinated in our state. We have about 120 people that have been vaccinated with the booster dose, and which the Excellency will also officially cover.
We know that there is a lot of vaccine apathy. People are a little bit worried as to what exactly will be the outcome, of the vaccine. But the good news is that a lot of people in Oyo State are very enlightened. They know that we have given them a lot of advisory. So we're making good progress.
So far, the state has vaccinated over 722,000 people, out of which over 200,000 have been fully vaccinated and 120 given a booster dose.
Staying in Ibadan, the Oyo State capital, Dr. Oluwaseun Akinyemi is a public health physician with the University College Hospital Ibadan, and he joins us virtually for more on the pandemic. Thank you for joining us on the program.
Thank you very much for having me.
Give us an idea of the COVID-19 epidemiology in Oyo State. I mean, with Lagos already recording astronomical cases on scene before, do you think that Oyo could experience the same with the fourth wave?
Yeah, according to the figures from the Nigerian Center for Disease Control, Oyo State is the number 7th or 9th now nationwide. And Southwest Nigeria is the second only after Lagos. So we still saw, as reported earlier, 38 cases of COVID infection as at yesterday. So we still have a number of cases, and Oyo State is like many other states in Nigeria. There are still some apathy towards vaccination, hesitancy. There is still reluctance to use the non-pharmacological initiative, wearing a face mask. Yeah, don't be, we may see many face masks where the governor is on the TV, but you go to the market, go to public places, only very few people use their face masks, follow hand washing and all. So we still need to do more in encouraging people concerning the non-pharmacological initiative. We also we see governors talking about booster doses. How many people have even gotten the regular doses, talk less of booster doses? And I think we still need a more coherent policy concerning the booster doses. We're just hearing from governors, maybe after 6 months you can go for booster doses, but the Ministry of Health, the NCDC, need to roll out a very coherent policy concerning booster doses for COVID-19 vaccination. So in Ibadan, Oyo State, it's still like many, it's just like a case study of Nigeria. The use of face mask, hand washing is still very low, and there's still hesitancy towards vaccination, and we're still seeing cases. So this is not the time to let down our guard, especially in this Unitary period. We need to put all hands on deck. Cancel any non-essential travel, make sure that we use our face mask regularly, and so that during this Christmas period, we don't have a super spreader.
Indeed. Dr. Akinyemi, is there also a need to perhaps issue advisories to health centers at all the levels? Because lately there seems to be a number of people coming down with, malaria symptoms and others, seeing as, we are in the Hamilton season. Are you also seeing such of these cases rise this period in your hospital, for instance?
Yeah. That's a very good observation. Anecdotal reports have been, some of my colleagues have complained. They have reported that there seems to be an upsurge of upper respiratory tract infection, malaria cases that are not responding well to anti-malarials. I believe that this is all health workers, doctors, nurses, and all health workers need to have a high index of suspicion for COVID-19 vaccine, for COVID infection, I beg your pardon. If you have treated somebody with fever and is not responding well, please run the test. And I also think that at the policy level, we need to do more about testing. It seems we have the passion that went into testing at the early phase of COVID-19 pandemic had really gone down. So we need to do more about testing. I bet many of the people that we're seeing coming down with malaria, many of them are probably COVID cases, possibly the Omicron variant spots. We are not doing so much of testing. So we need, like you rightly said, all hands need to be on deck. All health workers need to have a high index of suspicion for COVID vaccine around this time. I think that is the right way to go.
Doctor, thank you so much. Dr. Oluwaseun Akiemi is a public health physician with the University College Hospital Ibadan. Thank you so much for joining us today.
My pleasure. Merry Christmas.
Merry Christmas to you. Let's go over to Kano, where the state government has launched a COVID-19 exercise for access to healthcare across the 44 local government areas. Now, the event, which took place at the Coronation Hall, the government house, had all stakeholders in the health sector present. The governor also launched access to healthcare under Basic Healthcare Provision Fund, involving all sectors of health experts, including development partners. Our correspondent, Nanchin Vincent, reports.
Quality healthcare remains a priority for the Abdullahi Ganduje's administration in Kano State, as government officials and health experts gather at the Coronation Hall of Government House to witness the launch of access to healthcare under the Basic Healthcare Provision Fund. Like many other states in the country, the state government is launching a mass vaccination exercise as a strategy to mitigate against sustained community transmission and ensure that a greater number of its population is safe. Despite ongoing efforts by the state government, only 5% of its eligible population have been vaccinated so far.
So far, more than 434,000 people in Kano have received COVID-19 vaccine. In comparison with the population of Kano, with over 15 million inhabitants, only 5% of the total eligible population have been immunized with the COVID-19 vaccine. In line with this, National Primary Healthcare Development Agency introduced the SCALE strategies, which constitute service delivery, communication, accountability, logistics, aid, and supervision to ramp up COVID-19 vaccine uptake across states of the Federation, including Kano. The strategy is targeted to ensure all eligible people have received the required doses of COVID-19 vaccine in the country.
Governor Ganduje emphasizes the need for residents to get vaccinated, adding that the exercise will be all-inclusive.
Now we are going into mass vaccination, including all ages, including all strata of the population, be it civil servants, those working in private sector, the business community. Now we have opened a new chapter, and this new chapter, we call it mass vaccination.
The governor also presents checks to health facilities for the smooth operation of the newly launched health insurance program.
Still ahead on the program, more on the COVID-19 update around the world. Please stay with us. The United Arab Emirates is taking new steps to curb the sudden spike in COVID cases. The Middle Eastern country, which has the highest vaccination rates globally, has been recording cases below 100 until the situation took a different turn in recent days. Our correspondent Myra Diguke brings us more.
Parades such as this, as well as entertainment that encourage close contact at the ongoing Expo 2020, have been suspended till further notice. The World Fair, which kicked off on the 1st of October, has just crossed its 7 million visits mark and hopes to meet a 25 million visit threshold by March for both in-person and virtual visitors.
It's very spacious and there's so much to see and do. So as long as you follow the restrictions and you enjoy the surroundings, it's just an amazing place to be. There's so much to take in, and I think, mask up, keep your distance, but enjoy the surroundings.
Daily record of COVID cases in the country have gone from less than 100 to over 400 in the past week.
UAE is not exempted, so many people are coming to UAE, most especially for this program which is ongoing now. They call it the Expo 2020. So a lot of people are coming all over the world, at least to enjoy their life in Dubai precisely. So we should expect something like that to happen.
With the Omicron variant spreading globally, UAE has announced new guidelines ahead of the festive season, which include no hugging or handshaking at events. Also, venues must limit capacity to 80%, while those attending must present a green pass on the COVID app, as well as proof of a negative PCR test result from within 96 hours. As an extra precautionary measure, authorities in the Abu Dhabi Emirate have also erected a checkpoint at the border.
So for anyone who is coming to Abu Dhabi, there is this exponential deep examination device, scanner, which is advanced technology which is being used presently now to scan the driver and other commuters in the vehicle who may likely want to cross into Abu Dhabi, like the border right now. So if this scanner can detect any potential COVID-19 person who will be positive in the vehicle, the person will be required to get out of the vehicle and get to the on-site screening center to do the antigen test. And if it is possible, if the person is positive, if the person is coming from other Emirates, will be required to go back to whichever or whoever Emirate is coming from and notify the health authority of that Emirate, probably, and commence isolation from there.
In Dubai, organizers of the Expo say events at the World's Fair will continue over the Christmas holidays. From Dubai in the United Arab Emirates, Myra Diguke for Channels Television News.
And Myra Adegoke joins us now. Hi, Myra. Travel plans already cut short with Expo 2020 being suspended. Tell us what more the country is doing, especially with the festivities so close at hand.
Thank you so much, Minister. Just before we get into the festivities and what the government is doing, there is breaking news. Flights from 4 countries, including Nigeria, Kenya, Tanzania and Ethiopia, have been suspended, and this will go into effect from Saturday, 7:30 p.m. local time. This suspension also affects travelers who have been in these countries or traveled through these countries in the last 14 days. Categories exempted from this suspension include first-degree relatives, diplomatic missions, golden residence holders, as well as official delegation. They, however, will have to provide negative PCR tests taken within 48 hours before their flight, rapid tests taken 6 hours prior to the departure, PCR tests on arrival at the airport in the UAE, and then go into quarantine for 10 days. This is what we have right now, breaking story. Back to the question you asked with regards to plans for the festivities. Things are unfolding because, as we know, the Omicron variant is now causing a huge spike in numbers. Just within a couple of days, it was first detected earlier this month, first, second of this month, and then within a very short time, we've seen numbers go from hundreds to 200s, 400s, and today the new figures of this moment is 1,002. That's a huge spike. So the government is doing everything it can to ensure that the people are protected, but also we see that they're trying to manage the situation so that people can have the best of the season, travelers can come in. However, they are taking steps just to create that balance, I would say.
And Maiwa, you mentioned the latest news with the travel bans from some countries in Africa, including Nigeria. But did they mention the reason? Because you've also talked about the spike in cases, which might be due to the Omicron variant. Is there a specific reason with regards to those coming in from these countries that have been banned as to the reason why they're on that list?
Well, authorities are yet to give a clear-cut reason. However, it definitely will be linked to, this is definitely linked to coronavirus as well as the spread. So they haven't come out to say exactly what the reason is, but we're sure that this is definitely linked to COVID.
Tell us some more about the checkpoints at the borders, and also if, the Green Pass, which I know has been applicable in several areas, restaurants around the city, will also be applicable at the border points.
So this is mostly applicable at the Abu Dhabi border. So for those who are familiar with the country, you know that there are different emirates, like states, if you want to use what we're used to, a term we're used to in Nigeria. And so Abu Dhabi has erected this border where they do checks for everyone trying to get into the emirate. And rules apply in different ways across the country. For instance, in Abu Dhabi, this COVID app Green Pass is, it's a big deal in Abu Dhabi. You can't even access public spaces, malls, and the likes if your pass is not green. And then you come over to Dubai, is not the exact same thing. So it depends on, maybe you're attending a government event or certain types of event. So the rules apply in different ways. However, we know that across board, the mask is important. For some events, vaccination is required. For some, they're not. So this all depends across Emirates. The COVID Green App Pass does not apply to the airports. So this is mostly used internally.
So perhaps mixed reactions there to all of the travel plans to the UAE. Thank you so much, Maiwa, for the update.
Thank you.
And a 7-day average of coronavirus case count of over 168,000 has been logged in the U.S. amid a nationwide spike driven partly by the Omicron variant. The latest surge is the second largest wave of the pandemic so far, with preliminary data suggesting that Omicron is significantly more contagious than previous versions of the coronavirus. Well, here's more on the global update.
Americans are facing the second Christmas of upended holiday plans, with a surge in COVID-19 infections fueled by the non-dominant Omicron variant forcing some people to cancel travel and fret about whether it is safe to visit loved ones. The swift rise in infections from Omicron, first detected last month and now accounting for 73% of U.S. cases, has caused fresh concern around holiday travel. California will require healthcare workers and workers in high-risk congregate settings to get the COVID-19 vaccine booster by February 1st. Governor Gavin Newsom has said as part of the state's response to the highly transmissible Omicron variant. Russian President Vladimir Putin says he hopes Russia could vaccinate enough people to reach collective COVID-19 immunity next year, as he urges more Russians to get inoculated.
Current collective immunity level in Russia is 59.4%. I mean, the citizens who have recovered from COVID-19 and those who are vaccinated. About 70 million have received the first shot, and a little over 70 million have received 2 shots. But this is not enough. We need a collective immunity level of around 80%. I hope that by next year, by the end of the first quarter or in the second quarter, we will reach such level.
Australia's most populous state has reintroduced COVID-19 curbs as infections hit a record daily rise of 8,200 amid an outbreak of the highly infectious Omicron variant and a rush on already stretched testing clinics.
As of midnight tonight, we will be requiring that masks are worn in indoor settings. We are encouraging people, particularly over the holiday period, if you can work from home, please work from home. We do want to limit mobility just as we get through this period of time, and particularly in relation to ensuring that our health workers are able to be on the job and provide that care and support for those who are unwell.
The Chinese city of Xi'an has imposed tight curbs on outbound travel and commuting within the city, putting its 13 million residents in a lockdown as the new COVID-19 outbreak sees community cases tick higher.
Thank you very much for following WHO.
December the 26th will mark 1 month since the World Health Organization named COVID-19 variant B11529 called Omicron a variant on concern. Since then, its higher risk of transmissibility has accelerated the imposition of tighter restrictions across a number of countries in a bid to stem the new variant spread.
You can visit our website, it's Channels TV, for more updates, a better understanding of the pandemic as you celebrate responsibly. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.